Thank you for having me. Yeah.
Thank you.
Good morning, everyone. I usually would sit here, but I'll just stand for now. Good morning, everyone. I'm Dr. Ryan Balmes. Thank you for the introduction. This is my practice, ENDVR HEALTH, with a business partner with mine, and he wasn't able to make it here today, but we're located in Chambly inside Elite Edge. And for those of you that are meeting me for the first time, I've been a physical therapist since 2011. I've been here in Atlanta since 2013, so really been able to call Atlanta home. And really my start to like my career and like lifestyle is what you guys did this morning, is running. So I was a skinny Filipino kid that did all the nerdy stuff you could do: math club, engineering club, orchestra, piano. Athletics was just not in the cards for me, at least I thought. And then got into high school, and one of the cross-country coach, I think, was my teacher at the time, and he's like, you should join, and they didn't cut, which was perfect, so then I ran. I was in the far back, I was super slow, but that really got me recognizing the love of like, wow, running is really fun. It's fun when you do it with friends, and it really gets you in good shape, right? And let me just get like even full disclosure, like track season comes around, and you know, I'm a teenage boy, and then you have to practice with the girls. So obviously that helped too as well in getting me out there. But yeah, no, running has really been like my first love. I'm kind of now in an obvious love-hate relationship lately. I'll come into running and come out and do something else. But if you're running for the first time, or even you've been doing it for years, you understand that like it really is something that you could easily pick up and go, get a pair of new shoes, and just come out and go running. So today I wanted to talk about tendonitis. Has anyone experienced that before? Wow, props to everyone who didn't raise their hands. Congratulations, because when you get it, it's really painful. Does anyone know what tendonitis is and what it means and what happens, all that? Well, props to you as well, because when you look at the studies, they don't know either. Okay? And you're probably thinking, well, really? When I go to a doctor, don't they know? When you go see me, don't I know? It's really, you know, I was prepping for this talk and looking at the recent research. There's all these strategies, but they still haven't figured out what's the best thing to do for tendonitis. It's really, really odd. It's not contractile tissue, so it's not red and meaty, right? On your chicken wings, if you're having some later today, it's that piece of part where from the muscle connects to the bone, that in-between part, that's tendon, right? That's tendon. And there used to be a model, I admit I used to practice this way, where if you do certain exercises or if you rub it the right way, you could change the way the tendons are formed tissue-wise, microscopically. And I remember this paper clear as day during residency. They did a study on pig tendon, and they did cross-friction massage on the tendon for a few weeks, and sure enough, in a few weeks, you see the tendon microscopically look different. It looks more aligned. It looks better. And I would practice that way thinking, oh, I need to just rub tendon if it hurts. My patients hated me because it hurt. And the results really weren't that good. Maybe we shouldn't rely on pig tendon models for our own bodies. So one of the strategies, if you're thinking, oh, I need the tendon to look better if it's already injured, really isn't going to be the best case scenario. It's really odd. Pain relief. When you have tendonitis and you have pain, some of the studies are showing that it's not actually coming from the tendon itself. The tendon is sending off signals and then activating nerve endings nearby the tendon. So if you feel, oh, it hurts in the knee, but you give me like a vague description, that's probably why, right? Where we right now, what the science shows us is that tendon is giving off pain signals, but it may not actually be at the tendon, or it may be something else, and that's where it gets tricky too as well. But from a pain relief standpoint, if it's activating nerve endings nearby, you could do ice, you could do heat, you could do electrical stimulation, you could do pain gels, all that stuff. And that is okay. I'm not here to say that that's not important. So that's one strategy you could take home right now. If you're in pain at tendons, knee, ankle, ice, heat, whatever makes it feel good, go for it. Block the pain, and enjoy that relief, because you deserve that. No one deserves to be in pain, right? And if we have full-time jobs and you got to go out there and work, you want to have a pain-free walking experience while you work, right? But understand that that pain relief kind of just masks the symptoms. So when you go out on your run and you wonder, oh, the ice and heat made it feel better. Why is it happening on the run? Just know that it was just purely pain relief, symptomatic, and it's something that, that's something that you can do, but it's not going to help that pain when you run. Does that make sense? Yep. I think that's so important, right? I don't want to say, do this and you're good. Like, you're good pain-wise, but when you're running, it's going to be a whole different factor, right? So definitely consider doing that. So then, have you guys, I planned on bringing some, but you guys eaten donuts before?
What's a donut?
Bagels? Have you had a bagel before? There you go. Yeah, we have bagels there. And you see how there's a hole in the bagel, in the donut? So, believe it or not, this was actually in a study. It was the best way to help explain it. They're telling clinicians now to treat the donut, not the hole. Treat the donut, not the hole. Now let me explain why. They're saying now that tendons, once it's damaged or changed from injury, you can't change it. It's irreversible, right? So I am 33-year-old young. I'm sure I have tendons where if you look underneath the microscope, there's probably damage that I can't change back. I've had experienced quad tendonitis, patellar tendonitis right before a marathon, some Achilles, plantar fasciitis, and if you were to look into it, they're showing now that once you experience some sort of change or damage per se to the tendon, you can't really change it back. It doesn't respond to a lot of things. Which means that when they say treat the donut, not the hole, once things are damaged or changed, don't worry about trying to fix that. Make the rest of it as strong as you can. Does that make sense? So what does that mean exactly? So if I had my patellar tendonitis, I had to rest it, because every time I would run, it's painful, and who wants that? And then I had to get to the strength training, because we know tendons respond to load, healthy tendons at least. You do enough strength training, you modify the volume, stick to a training plan so your volume doesn't increase too much. The tendons will like that, respond to it, and make sure to get stronger. But the damaged stuff, the hole, it's too late now. It's a wrinkle on my skin, right? I'll take it with me, and that's okay. Because I won't feel it. After a while, after I kind of do all the first aid stuff, relax my volume, do any pain relief, then it should subside, and then I strengthen the crap out of my donut. Strength training, modify your running form, things like that. Does that make sense? So treat the donut, not the hole. Okay? That's really kind of the main answers with tendonitis so far. And trust me, I was looking and preparing. I was like, is there a magic bullet? Not quite. And I've shared a few magic bullets before, right? Let's say if you were in any knee pain, increase your step frequency. For those of you that have heard me before, increase your step frequency and it help decrease the pain. And the whole reason for that is because then your impact on the ground is much less. If you decrease your impact, there's less muscle contraction, less pull on the tendon. It's all about minimizing load and making it as efficient as possible. When we talk about training volume, making sure, when you're with a great group like this, who has a great training plan to make sure you don't do too much, that allows you to be in a healthy progression with your body and your muscles to say, okay, I'm getting this, and I'm getting a little stronger, and I'm getting a little stronger, and it's a good progression. Because if you didn't, if let's say you weren't part of the group and you decided, hey, I'm going to run 10 miles total one week, and I'm going to run 30 miles the next week. That's almost a double, if not more, increase in volume. Your body may not quickly adapt. I think a 15-year-old may adapt, but as we're getting older, we know changes in terms of how we recover is a little bit slower. So you always want to make sure that your progression week to week makes sense. Some of the key numbers that they say is no greater than 15% from what you did before. But then runners come to me and then they say, I have a marathon in 4 weeks. What do? I still need to run my mileage. if you're that person and you come to me and you give me that much timeline, I'll be brutally honest with you, but I will always do my best to like get you to that goal. But I can't guarantee you pain because 4 weeks may not be enough time. But I can guarantee you, a way to continue your training and bring it to your goal. I rarely ever shut someone down unless it's like a life-threatening event. Knee pain, not so much life-threatening. If you're training for a marathon that you've always looked forward to for 20 years, I don't want to stop you from that, If you run it in pain, it's okay, but you'll finish. You'll get to your goal. Maybe your 10 out of 10 pain will be a 7 out of 10 pain, but you still finished. And I'll give you a thumbs up. You're like, congratulations, That's that kind of realistic approach that I apply, and rarely would I ever want to shut anyone down because, we all have our goals. We all have, like I called the practice our endeavors of what we want to do, and I want to make sure you guys complete that, even if it is in pain. Because we shouldn't let pain control our lives. And again, like I said, if it's not life-threatening, then it's okay. This is on camera and I'm recording. It's okay to be in pain. It's okay to be in pain, just as long as we're aware that, what are the ramifications for that? Is it going to put you at risk for something else with that? Question so far with tendonitis. You guys want to share any cases? I think that's where the main value is sharing, and that's why you're in groups like this, to be open and maybe even vulnerable to say, you know what, I have done this. What do you think about that? So any questions with tendonitis at all? Yes, Lindsay.
Is it typically caused by like a traumatic event, or could it be an overuse thing? How does tendonitis sort of develop?
Yeah, great question. So in the studies, they have what they call an acute load. So that's for someone that did 15 miles 1 week, then 30 miles the next week. That would be an increased acute load, right? Or let's say if I was playing soccer and I decided to do one hard sprint towards the goal, and I've never sprinted in a long time, I've increased the load through my Achilles tendon like crazy. That may aggravate it. So acute loads could bring on that tendon pain. And what I forgot to mention, what they know about tendons, it needs about 2 to 3 days to recover. So if you ran today, let's say 10 miles super hard, and you decided to run tomorrow 20 miles super hard, your tendons probably are going to be a little angry at you. But if you ran 10 miles a day super hard, and then you ran tomorrow 5 miles somewhat hard, I'd argue that your tendon could make it because it wasn't as hard as the bout that you just did. It's still healing, but you didn't make it a lot higher. Does that make sense? That's why sometimes people say active recovery. Active recovery is great because you do an increased training load, and then the next day you're moving, but you're not moving to the point where the tendon is now getting really aggravated because it's still recovering. Does that make sense? And they've shown that with some of the kind of imaging studies and kind of microscopic studies of it takes about the 2 days for a tendon to recover. But that doesn't mean you have to shut it down. So if you ran today and you decide to, go kayaking tomorrow or a spin class, it'll be all right. Our body's amazing and strong.
But you said earlier that the damage is already done, the hole.
Yeah.
Right? So you're saying that if you overuse, because I'm not so you've got some inflammation going there, that it's okay if it's inflamed and you're pushing through that. Where if you created the hole, and I don't know how do you know the difference between the hole and the inflammation?
Okay, this is a great point.
Show up on an X-ray or anything?
It won't show up on an X-ray. It'd show up on an MRI or an ultrasound. X-ray shows for bone, so it won't look through muscle, won't look through tendon. MRI and ultrasound, but I don't have an MRI machine in my pocket. They're pretty big. You can't pick one up at Target. They're pretty expensive. So it wouldn't be really feasible to keep MRIing us every time. But to your point, that kind of, that doesn't make sense. It's a really good point. When I say tendons recover, let's say you did your 10-miler today and you're not experiencing any pain. So let's say pain is your signal of injury. It still has to recover from the load. So if I did a bunch of bicep curls today, I'm not injured, but my tendon's not necessarily injured. There's no hole per se, but it's recovering from that training load that I did. Does that make sense? But if I did a bunch of bicep curls and then I started getting pain and irritation, then I think it's safe to assume that I've created a hole in myself. and then it's still going to recover. But now when I exercise the next day, I'm exercising the donut part of my tendon, not the whole. Because the whole now is going to be non-responsive, I can't really change it, and it's not helping a lot to transmit force from muscle to bone. Does that make sense?
And is that tendon now gotten a lot weaker because of the hole? Are you more susceptible to more catastrophic injury, like a tendon rupture?
Yeah, no, great question. If let's say we have the hole and we're treating the donut, if let's say you kept going on that acute inflammation, that chronic pain, and continue going, you're just creating more holes, more holes, more holes, not much donut left. So I'd argue, yeah, that you probably put yourself at risk for a tendon rupture, which there's other factors too. But again, if you were able to, that's why that first aid approach is decrease load, manage load through running form, exercises, and then just strengthen the crap out of your tendon in a healthy way so that the donut part remains to be strong. And maybe, I like to think philosophical about this stuff. Maybe that kind of makes sense, right? Maybe I shouldn't be playing 5 pickup games of basketball when I'm 40 years old because maybe I'm just not strong enough anymore. And I say that because I'm playing pickup basketball with a few friends later today, and I'm kind of like scared. Like I have not played basketball in forever. And like, so if you see me tomorrow posting on Instagram that my Achilles is like hanging around, it's because of that. Like I know what could happen. So I'll share it on Instagram if my Achilles flares up, then I'll show you that I experience this stuff too. But you bring up a good point in that, as we get older, we should start thinking, if I wanted to run a marathon and I hadn't ran it in forever, let's say 50-year-old me and I hadn't run it forever, I'm gonna have to be very careful with how I progress that because I know I've had battle scars along the way. And it's okay, they're beautiful battle scars. It shows that I've lived life. But now I can't approach my marathon approach when I was 21 when I'm 50. Does that make sense? The mind's willing, but the body definitely has those beautiful battle scars of life to say, you're gonna have to approach it just a little differently, but that doesn't mean it's impossible. It doesn't mean it's impossible because the body is so strong, resilient, but you just have to do it kind of in its timing, and you'll get to the goals that you'd want. Yeah?
So after you say decrease load, manage mechanics, strengthen, does stretching before or after exercise affect tendonitis?
No. Yeah. So a few studies show stretching doesn't prevent injury done before any organized sporting event. It's really odd why we still do it. I think it's like a cultural thing. We just want to be able to stretch it. But remember now, stretching is like a feel good. So just like ice, heat, all that stuff. If you want to stretch to feel good, that's perfectly fine. But we know that we may not be doing anything really to help, especially like from a strengthening standpoint of the donut. So stretching, because not only are you stretching tendon, you're really stretching also muscle. You're allowing and improving your tolerance to changing of length. But how much does it actually transmit to the tendon? We're not really sure. Contractile, like muscle activation and contractile really helps that tendon to tell where to go. But stretching it, sure, I'm stretching my tendon, but it's probably not as strong enough stimulus than muscle contraction.
Are there any supplements that you can take that can help the tendon? I mean, they talk about what are some of the things for your joints and all like that. Is there the same thing for tendons or a different diet?
Yeah.
Increasing something in your diet?
Yeah. Good point. I wish I could answer that fully. I've read into some things and thinking that it's just a mixed bag. It's hard, I think, to study it. But I'm sure if there was a registered dietitian here, would probably best answer that. Because I've looked that up as to like, is there anything that can help? I think the one thing to comment on that is just to optimize, make sure we're just doing the right things outside of our pounding payment. So getting good sleep, getting nutrition, stress management could all help that. But as to like the magic bullet, like eat this and your tendon is healthy,
Yeah,
I don't know.
I think there was a magic bullet, but
We all wish there would be.
if you've got like a tendency to have tendonitis, is it because genetics? Is it because your diet? Is it because of both? Is it,
Yeah, yeah. I'm not sure. From a food standpoint, like I wish I could help. Yeah, yeah. The I know there's talk about like inflammation and foods and all that, and that's like really outside my scope. I just say, do the best you can with research, and if you want to talk to a registered dietitian, they can help with that. But yeah, that part I just don't know.
Well, I have arthritis, and so I know first thing in the morning I have to get up, and I'm going to be stiff, I'm going to be sore, and I'm going to hurt.
Yeah.
But I need to get up and move around.
Yeah.
And stretch.
Mhm.
And so I just keep the yoga mat right there next to the bed.
Sure, sure.
Yeah.
Yeah.
Roll out of one position into another.
Yeah.
But I've started noticing like one foot, the toes, beside the, it's not important. Some of my toes are starting to hurt, and they're not at the joint, so I don't think it's arthritis. So I think it might be tendon.
Yeah, it could be tendon. There's at least 3-4 layers in the foot of muscle there. And it's great that you're able to kind of distinguish which one's which.
Well,
Right.
I'm not a doctor. What do I know?
No, but the thing is too is, when you say I'm not a doc, but you're in charge of your healthcare. This is your body, right? And as a clinician, I always respect that, like, this is your body. Like, whatever you'd want to do, I want to help guide you on that. And you know it better than anyone else, really, even with all the scientific studies and all that. But yeah, so from a joint standpoint, mobility is going to be helpful. You touched upon arthritis, a little related to tendons, but we found that joint surfaces, tendon, love movement. But you got to be what I call that Goldilocks rule. You just got to do it just right. Not too much, not too little, right? You want to be right there in the middle. And managing this gray area of Goldilocks, that's the beauty of life, right? Like, that's what we have to all kind of figure out. And it's always a constant game of, did I do too much today? Did I not do enough? I know for myself, I wasn't able to get into the gym as much as I'd like, and I felt achy, sore, sometimes even irritable, like, feel tired. Get back in the gym yesterday and I feel invigorated. So I think there is something to be said with how our body, our brain responds to movement. You bring up arthritis. I think one paper suggests there may be even blood markers that's unique to arthritis. So arthritis, there's always still research as to what it is. Me as a biomechanics nerd, I always thought arthritis is more just too much pounding, poor mechanics. But no, there may be actually something possibly in the blood too as a marker for it, or it is genetics too. So that part really is just we're still learning what that means.
So if you suspect that you have tendonitis, what is there like the whole thing where I get up every morning and I do this whole routine of stretching for the arthritis piece of it, and that kind of how I target into that's my foot. And
Yeah.
tendonitis. Is there something I should be doing prior to doing those things to keep so those tendons aren't? It almost feels like they're being stretched too soon or awakened too soon, or they're still in bed and the rest of me's not, that sort of thing. I don't know.
Yeah, I think.
Once it sets off, it takes a while for them to calm back down and not hurt the rest. Now, they will eventually. But
What did you mean by set off? Like, is that pain?
yeah.
Off the tendon area?
Yeah.
Yeah.
And it'll radiate down into the ball of my foot.
Yeah. I think if you're doing the mobility and stretch is all great stuff. You want to be able to expand your range of motion, expand your range. Start adding some sort of strength training for the muscles for that. Oh yeah, there's plenty. You could do heel raises. That works the bottom of your feet. There's believe it or not, there's foot exercises for the toes. You can increase up your toes and back down, right? You can I'll make a video about it. I'll make a video about it. You can walk barefoot up under your toes, things like that. Yeah. Yeah. Getting that feet active, things like that. If you have a sand volleyball pit nearby, start running around in that, walking in that, get your foot active. That was just an idea. You don't necessarily have to do it. There you go. Yeah, that'll get your feet active. It'll also get your ankles active. But really start adding some sort of strength training with that too. You could even do single leg balance exercises, right? Barefoot. Start looking left and right. Your feet are going to be really active from that.
What's that?
There's those exercises show you have to try to pick up your different toes?
Yeah, I love that one. Yeah, we're the one where you pick up your big toe, but the other 4 stay down. That's isolation of one tendon versus the other. Interesting note, your big toe, if let's say you, for whatever reason, you did not have your big toe, you would not be able to run. You wouldn't be able to stand. That big toe is big for a reason. It provides you balance, right? So the stronger that big toe can be, the better you'll be in running, right? So yeah, from a toe standpoint, there's a ton. So when in doubt, there's always some sort of strengthening exercise, and I'll remember you. I'll make a video. I'll have to clean. I'll lotion my feet and make sure it's all pedicured up before I get on video here. And that video may be banned if I don't, to be honest. So. Yeah.
Suspected tendonitis in the knee.
Yeah.
One of the more difficult areas to treat because because it's the knee and it's a more challenging area.
Challenging in terms of the treat and have it resolved.
Right.
Yeah.
In terms of having it resolved.
Yeah. So I'll go back to like my personal experience and a few of my clinical experiences. When I was training for the marathon, I think I've shared this story before. For the LA Marathon, I increased the volume way too much. I got a little overzealous, and I thought I was making sure the 15%, but the other variable I probably didn't account for was the hills and my intensity of that 15% increase. So to go back into that volume standpoint, it's not only the amount of miles, it's how you ran the miles, where you ran the miles. I'll even go and put the other variable of what time you ran during the day, ran the miles, right? 6 p.m., 10-mile run after a 10-hour workday is different than 6 a.m., 10-mile run before your 10-hour workday. Does that make sense? Yeah. So many variables. I love picking those variables when I have a client. I was like, when are you running? How are you running? Things like that. So I was running a sharp pain right here. So this is our quadricep muscles. And it becomes tendon, and it comes right here to the patella. So I didn't have traditional patellar tendonitis. I had it here, and that was super painful. Consistently, so I decreased my mileage and my load, and I rested, allowed the tendon to heal. But consistently, every time I run, it would happen about 30 minutes in, and it'd sharp pain again. So at least it was consistent. I could plan for it. But you're right, it is tricky because then you have to constantly think about the other variables of like, what can I do to push 30 to maybe 45, 45 to 50, right? So believe it or not, on the LA Marathon run, I remembered you guys, I did some run-walk stuff. So I ran, and then around like the 25-minute mark, I walked, knowing that if this happens around 30 minutes, I'm not gonna get there. It's getting fatigued, I'm not gonna get there, I'm going to walk. Fast walk, and actually I did that with my brothers for a majority of the LA Marathon, and it worked. And then I got really overzealous, and I said, well, I think I can make the 30-minute, and it actually like felt better, and then it started to creep up again. So it's like that warning light on your dashboard, and then I just said, all right, I gotta turn down the gears, and then go back to that. So that's one way to manage it in race, because when I experienced this, it was only like 6 weeks before. Knowing what I just told you now, there wouldn't be enough time for me to make this resolve for the entire race. Does that make sense? Like, I knew it was going to come back somehow. So to answer your question, it's always managing those variables as to where to think, what can you do to at least either push the can down the road for it to be painful later, right? If you don't have enough time to resolve it before your race. If you have a ton of time, then you have the luxury of really analyzing everything from your training load, running form, strength training. You may even have time to even just take a break and stop and do other things to maintain either your heart health and your strength and then get back into running. So the more time you have a lot more luxury to have it. But if you have a short amount of time, I think that's where it gets difficult because now you have a short amount of time and your race is coming. And you got to manage it because you don't want to make it worse either, right? Because if it gets worse, then that run is painful. Does that make sense? So you have to manage. So for me, I strengthened a lot of the quadriceps. I rechecked my running form. This was before the race. I still did the run walk. And the same things with clients. I will always look then, let's double check your running form. Let's check shoes. You have old shoes. Let's refresh those. How's your strength training? Not much, okay, let's add a little bit of that. I throw the whole sink at it now, right? Because you all deserve that. I throw the whole sink at it, whether we have a lot of time or short amount of time. Let's take all these variables and then see what happens. And that's why I think it gets difficult, especially if you're trying to figure it out on your own. But it is possible. You just have to figure out which variables you want to control. I like to lean more that if you haven't done strength training, get some strength training going. That way more of your muscle could take the brunt of the impact and not so much just the tendon. Does that make sense? And muscle heals much faster than tendon, so you could strength train it, keep it moving, things like that. Does that answer your question? It's tough. It's fun to manage a little bit, at least from my end. I know it may not be fun for you. But yeah, those are some of the strategies. If you have a lot of time, you have the luxury to kind of pick and choose. But if you don't have a lot of time, you have a short amount of time, it's more kick the can down the road, and then let's see what we could do to make it feel the best that it can during the race. Any other questions? It doesn't have to be about tendonitis. It could be about anything else, running-wise.
Well, where are the tendons in your foot? Just where the joints are? Or, I know ligaments are in your foot, but where are the tendons?
Sure. Here. All right. Just gonna expose myself. We'll share a little bit. Pretty sure I took a shower this morning. So you have this tendon here. If you guys could see that, that's your big toe, extensor hallucis longus, that extends the toe. If you see my 4 other toes, you see those tendons there? Those are your extensors. You don't really use them with running. Pretty much if you're not tripping, you're using them. Okay? Does that make sense? Like if you're tripping, then the toes are either down and you fall, right? So if they're up, you're good. Achilles tendon. I know very popular in the news lately with Kevin Durant. But don't compare yourself to Kevin Durant. He's a freak of nature. He's a professional.
So pain from that, how far does it go up?
Very good question. You could have pain here, right where the tendon meets the bone, right? So that's more of a bone tendon involvement. You could have it a little bit higher. There is a bursa behind this tendon and your bone here. You could have pain there. Or you could have pain where it's up a little higher. That's where it gets tendon and muscle. Okay? So there's all those aspects that you may have. You may even have had a recent client, you may have like a bony deformity happen, maybe over time. That may happen on the inside of your heel or the outside. And again, beautiful scars of life, it happens. And then again, you gotta just treat that donut, not the hole.
So plantar fasciitis, how does that involve the tendon?
Yeah, good question. So plantar fasciitis, the bottom of the foot, you can't see it. Well, you maybe see it. I don't know if you can see the slight tension underneath my skin. So the plantar fascia is a fascia. It's not so much tendon. I think I'd like to. It's like equivalent to like the IT band a little bit, right through here. Okay, that responds to muscle load as well. So I'm activating my calf. It helps turn on the Achilles, pulls onto the heel, and strengthens the fascia here. Also, big toe flexibility. You could see it tension. I'm relaxing my ankle. If I bring my big toe back, it starts to stretch that as well.
What does ice massage do for plantar fasciitis then? Is it getting on the inflammation? Is it just
A little bit, but it's pain relief.
like
Superficial. Yeah, there's nothing wrong with that. You're welcome to do it because plantar fasciitis can be painful. One of the key things plantar fasciitis is to get your range of motion back. So dorsiflexion, like this ankle back, and the big toe. Making sure you have that. And then from a plantar fascia standpoint, strengthen the toes like we talked about, and then strengthen your heels. And then watch your running form. Because every time you land, you got to push off and make sure you're pushing off forward, not to the side or rotation.
so does getting the
You
motion
really
back
can't strengthen tendons, you're strengthening the muscle around it.
Yeah, I think you strengthen muscle and it tells tendon how to be strong. It does, so you're definitely doing both. You were saying?
So getting the range of motion back, is it stretching the plantar fascia and that makes it less like wear and tear, less force?
Maybe not so much wear and tear, but able to transmit the force in a more increased range. Because if I wanted to run fast, if I wanted to run from here to the finish line, I'm going to push a little bit more. But if I didn't have that range of motion to begin with, then the plantar fasciitis is like the last limiting link. Does that make sense? I try and push more, and plantar fasciitis says, you don't have that much, and then you may start causing that irritation at the tendon. So yeah, so it would be, you could do this, you could even do this where you bring the knee forward. You see how much range of motion I get at the ankle? And then you could take the big toe and stretch it out even further. I wouldn't recommend it if it's in pain. You may have to do other ranges where it's tolerable.
You don't have any objection to a tennis ball with your.
You're welcome to do that. It's a pain relief. But I'm a little skeptical of whether what we do from exterior actually changes at the tissue level. Meaning, if you took a really nice slab of steak and you pounded the crap out of it, you still didn't change you'd have to pound it like a lot. Does that make sense? So I'm just skeptical of whether we could do the same thing.
Just work.
Yeah.
Yeah.
Yeah. But it's more of, I think it helps more from a kind of pain relief standpoint, where if it feels good, then I think that's where it works. So yeah, I wouldn't be objected to it. But I'm always mindful of why we're doing it. If it's a pain relief standpoint, let's go ahead and do it. But to get more mobility will be those stretches and the strengthening exercises.
Painful when you do it, but afterwards you have to lose.
Yeah.
Can you further aggravate the injury if you're doing strength training? So for instance, if you increase the volume of your strength training too rapidly, can you further aggravate your tendonitis?
Yes. Yeah. So that's where then you have to be careful with the strength training itself and making sure it's progressive as well. And my thing is, if you haven't strength trained ever and you're running a lot, don't go too heavy, but don't go too light. You can just get started to let the muscles learn how to contract, pull on tendon. But if it's still painful, you may have to figure out another way to contract the muscle. So one interesting study from a pain relief standpoint, they did tendonitis at the knee, and they did just straight isometrics, which means you turn on the muscle, but I'm not moving anywhere. And for whatever reason, they don't know why, it provides pain relief for like a day. Really weird. It's really interesting. I wish I could say how and why, but that's what the studies show. You do isometrics of the quad tendon, and it